All right, viewers, let's move on right now. In the national capital, the situation where the COVID crisis is grim. The latest has been that the Deputy Chief Minister, Manish Sisodia of Delhi, has written to the Defence Minister, Rajnath Singh, asking that the army be brought in to manage the COVID crisis.
Delhi is devastated. If you live in the national capital, you don't need us to tell you that. The crisis is all around you. And now things are so bad that the Kejriwal government has activated the Code Red. Kejriwal government has asked for the Indian Army to be deployed to rescue Delhi from the death grip of COVID. The Delhi government has sent an SOS to Defence Minister Rajnath Singh seeking the Army's urgent intervention to set up an additional 1,000-bed ICU COVID facility, non-ICU COVID quarantine centres, and to provide any other assistance possible in the multi-layered crisis in the capital. The 1.1 million strong Indian Army has unmatched logistical strength, and this could be enlisted now on a war footing. For instance, rapid vehicle fleets for emergency supply and delivery of oxygen and drugs between states and cities. The army can rapidly set up COVID facilities in any part of the country at short notice. The army can also deploy its huge manpower and supply chain logistics to speed up vaccine delivery. It can deploy medical staff and manpower to scale up testing anywhere very, very quickly. And it can provide rapid strength for containment area enforcement in any part of the country. The government has set up a special COVID crisis committee under the Integrated Defence Headquarters to coordinate relief efforts both within the military as well as aid to civil authority. The panel is headed by Lieutenant General Madhuri Kanitkar, who already has a battle plan for Delhi and beyond wherever required.
The armed forces is ready. It has been ready for a while, and though we've been fighting this war against COVID for the last 14 months, I assure the nation that we are all ready. A normal war, we have our soldiers up front and we medical people are the shoulders. But today in this war, with the virus as the enemy, the doctors and the healthcare workers and all of us, we are the soldiers, but we have strong shoulders with us. So it's a co-jeet. We cannot do this alone. And our senior leadership is supporting us in every way.
The Indian Army is already deployed in the COVID fight. For instance, last week, the Defence Minister granted the Armed Forces emergency access to funds to set up and operate quarantine and treatment facilities for COVID patients. Before that, the Defence Ministry announced it was roping in 600 retired doctors to be deployed in the COVID battlefield. The Army has also extended the tenure of all Short Service Commission doctors till the 31st of December this year to have all hands on deck. But the current crisis means the Army's full strength will potentially be required to win the war. The Army's sister services, the Air Force and Navy, in oxygen logistics duties from home and abroad. With Delhi formally calling for the Army, has the war against COVID entered its most decisive phase. With Gaurav Sawant and Abhishek Bhalla in Delhi, Bureau Report, India Today.
Viewers, as the country is neck deep in crisis, a lot of foreign aid has been pouring in. A lot of it which the government still doesn't know how to utilize. Criminal, many would suggest. Why? Because I'll give you an example. The government till now, in terms of the customs, has only released 48,000 concentrators. Concentrators are the need of the hour where people are actually dying outside hospitals for the want of oxygen. Today, the Supreme Court asked the centre to reply to the question on why only 48,000 concentrators have been released, why are the rest of them still in customs, waiting to be given out while people are struggling to breathe.
जो भी बोल रहा है कि ऑक्सीजन अवेलेबल है सब झूठ बोल रहे हैं देयर इज टोटल chaos
करे बाहर से आ रही ऑक्सीजन बाहर से आ रही ऑक्सीजन बाहर से आ रही तो क्यों नहीं मिल रही हम लोग को
With the monstrous COVID surge plunging India into nothing short of an apocalypse, global support has poured in from all corners, rekindling hope that the country would soon defeat the virus. Consignment after consignment has flown in, and you would think this would begin to turn the tide. But what India was subjected on Friday was a shocking admission from the government.
विदेश से जितने भी हमारा जो सामान आ रहा है वह मिनिस्ट्री ऑफ हेल्थ उसको समझ रही है। समझने के बाद एक प्रोसेस है, बेस्ड ऑन नीड उसको एलोकेट किया जाएगा। कुछ ही देशों से जो हमारे मित्र देश हैं जिससे कुछ सामान है उनको कोऑर्डिनेट करके उनकी सप्लाई लानी शुरू हुई है। वह प्रोसेस अभी इन प्रोसेस है, उनका लॉजिस्टिक्स और मूवमेंट टाई अप किया जा रहा है।
Yes, you heard it right. The government is still trying to figure out how to utilize all the foreign aid that has poured in to curb the second wave. This at the time when thousands are losing their lives daily, literally gasping for breath. But enough is enough. India demands answers.
What we do have, huge numbers of consignments of foreign aid, including oxygen concentrators from different parts of the world, including the US, UK and several other countries. What we don't have, transparency, speed, urgency and priorities over just how these are being used and whether they're reaching the big hospitals in Delhi and elsewhere where patients are literally, as we speak, even now, gasping for breath and losing their lives. We will continue to demand answers and transparency on the aid that's coming in from abroad.
With patients gasping for breath and relatives falling at the feet of government officials for life-saving drugs and oxygen cylinders, all the international goodwill that has poured in for India means nothing if it isn't swiftly being deployed to save these lives. Bureau Report, India Today.
Whereas the fact is, if you've been reporting on the ground, which I have been, and I can say things are only getting worse. It's not getting better, at least in Delhi. Now, viewers, the head of the National Covid-19 Supermodel Committee has said that India is going to get worse. It's going to get worse and we're going to peak by May 7th. And then maybe India might turn the corner and our cases might start receding. He's from the same organization, viewers, which warned the government in the first week of April that a second wave was coming, and it was big.
There will be a second wave in India, and that is expected soon, had warned the Committee on Covid-19 Supermodel on the 2nd of April itself, raising questions on whether this was paid any heed to. Scientists who made this prediction, however, say that they did not expect the second wave to be so ferocious.
Somewhat optimistic estimates for the peak, which have since proven to be incorrect. We thought the second wave would peak out at around between 1 to 1.2 lakhs at the daily maximum. As it turned out, the disease became far more contagious during the month of April. So with the result that the daily case peaks kept climbing and climbing and climbing, and now we are at around 4 lakhs.
This comes at a time when the country is witnessing a critical situation with a rapidly increasing case burden, sending hundreds to hospitals and morgues. The three-member National Covid-19 Supermodel Committee was formed by the central government to make projections about the spatial and temporal spread of the pandemic. They suggest that different states are peaking at different times, but the nationwide peak is expected as early as the 7th of May.
The pandemic basically started in the state of Maharashtra. So Maharashtra is already in a decline. You will see that. Now other states started peaking a little bit later because the pandemic traveled across the country. So they will peak perhaps not next week, but the week after that. To summarize all of that in one single number, if you take the nationwide total cases, we anticipate a peak by the end of next week.
Also adding that a natural outcome would be a decline in cases start May 7th. Epidemiologists say that credible mathematical projections are necessary to understand and charter the course of the pandemic and tweak the responses around the projections and the predictions. It is clear that this particular panel did tell the government of India that a second wave is expected. What did the government really do about it? Did the government look into these suggestions? And what were the preparations then made to handle this monster raging second wave? The question is yet to be answered. In New Delhi, Sneha Mordani for...
Okay, viewers, let's get back to our COVID coverage. Like I said, I'm outside the LNJP hospital, and I have to say, in days, because I've been making the rounds of all government hospitals daily, for the first time I have seen that the emergency is open. It is accepting patients, which is, the silver lining in this pandemic, because we've seen people actually dying right here outside the gates of the LNJP. All right. The fact is that the government was caught napping. They were warned that there was a second wave coming in. But how is the government now handling the second wave? My colleague Sneha Mordani reports.
No national lockdown, no insistence on RT-PCR tests during interstate travel, and ban on indoor gatherings of more than 10 people. These are some of the recommendations made by the country's task force to the Government of India as it battles the raging second wave. Amidst a growing clamour for a pause, the panel says a localized response is what is required. For this, categorization on low and medium risks and a third category of hotspots would help. Depending on how far they have used ICU capacity, the testing rates and the 7-day moving average in cases, and also the test positivity ratio.
We need to identify these areas and reduce the speed of transmission, especially in areas with high transmission, by doing local lockdowns or regional lockdowns. So therefore, having national lockdown will not be useful in reducing overall. For this, we have given the guidelines.
India's R rate shows one infected person is infecting 1.5 individuals. At this rate, each infected individual is infecting another 1.5 persons. The rate of increase in reported new cases averaged 6.8% for the month of April nationwide, while the rate of increase in reported new deaths averaged 8.3% over the same period. With over 3 million active cases, the healthcare system is under severe strain. It is imperative, therefore, to reduce the continuous rise in new cases. Given the exposure of the fault lines in the medical system, the panel has asked for ramping up supply to prepare for future peaks and to train medical staff, interns and residents and use them as a backup.
India Task Force Lancet Commission, we talk about upping the medical preparedness, for which we recommend training residents and medical students as backup. People can do simple things like taking care of, measuring oxygen levels or pooling and optimizing resources, as well as expanding their role of these residents in offering supervised home care.
It has also asked for the need to ramp up genome sequencing to 5% of all tests and said there should be no restrictions on domestic travel, and also says RT-PCR tests should not be required during interstate travel.
We've organized these into 4 categories. The first is around saving lives and combating the illness by ramping up the medical system. The second set of measures is around minimizing transmission. The third set of measures are around containment of the epidemic by ramping up testing and contact tracing and isolation. And the last set of measures are around open communication, using data for better decision making.
Among other suggestions made, a complete ban on gatherings of more than 10 people, closure of indoor spaces, mandatory universal mask wearing in confined spaces and outdoors as well, and focus on cross-ventilation of indoor spaces. It talks about greater community involvement and also credible and regular projections of the trajectory of the pandemic. There is no one single response to the pandemic, is what the task force has told the government in its report. It can take the best performing countries by surprise. The pandemic is a fast-moving one and it took India by surprise. It says because the pandemic is a fast-moving one, the response to the same also should be rather dynamic. In New Delhi, Sneha Mordani for India Today.